Okay, in our video series on emergency medicine, in this video, we'll be talking about choking. We'll discuss that how to approach a patient who is choking. We'll discuss that how to give back blows to the patient. We'll discuss that how to perform Heimlich maneuver. And we'll discuss in which patients do you need to go for CPR. First of all, what is choking? Choking is a blockage of airway by any foreign body. Usually, people who are eating food and they start to talk at the same time. At that time, the food is in their mouth, and when they open the trachea while talking, the food enters the trachea and airway is blocked. That is the point of choking. Blockage of airway by a foreign body, usually caused by a bolus of food. And in children, you would find that children would be playing with small toys, buttons, or coin, and they would have that coin or button in their mouth, and all of a sudden they'll start choking. They'll start having obstruction of the airway because they would have inhaled that coin or button into their trachea. So now the presentation of the patient would be that the patient would have severe airway obstruction, usually while eating or in children while they are playing, and they would be clutching their throat in an effort to breathe. That is a classical presentation of a patient with choking. Now, when a patient presents to you with choking, the first thing that you need to do is that you have to assess severity. You have to ask the patient a question. You have to ask that, are you choking? No, this sounds ridiculous that why are we even asking this question when the presentation is quite obvious? The purpose of this question is to classify the patient into mild or severe. Usually the patients having mild choking are able to answer to you, and those patients who are having severe choking, they're unable to speak out a single word. So other than that, you have to observe the coughing pattern, whether the patient is coughing properly or not, whether the coughing reflex is strong or not. In mild case, patient would be able to answer your question. Patient would be able to speak out a single word or two, and they would have effective cough reflex to cough the foreign body out of the trachea. If the patient is having mild choking, if the patient has effective cough reflex, then you encourage the patient to cough more and cough the foreign body out. And then you observe the patient whether the patient is successful in attempting to cough the thing out or not. In severe case, when you ask this question that are you choking, that patient won't be able to respond to you with even a single word. Patient will be unable to speak, and patient would have ineffective cough. The cough would be weak. It means that patient is unable to cough the thing out. Usually it happens that the patient have effective cough reflex initially, but as after some time, their airways get fatigued and their cough reflex is ineffective. Or in old people, the cough reflex is ineffective. In that case, the choking is severe. In such case, then you need to observe that whether the patient is conscious at that point or unconscious. Usually it happens that the patient are sometime alone in some place where they are choking and they are trying to cough the thing out, but after some time their effective cough reflex is now fatigued and they have ineffective cough, and after some time due to severe airway obstruction they get unconscious. In an unconscious patient who is having severe choking, you need to start CPR, because in an unconscious patient who is not breathing or not having pulse, CPR is the immediate management and you call for help. I have talked about how to give CPR in a patient in my video on cardiac arrest in detail. You can check out the video in the link given in the description below. If the patient is conscious and patient is having ineffective cough, or patient is unable to speak and patient is having severe choking, then in conscious patient you have to give 5 back blows and 5 abdominal thrust. It means that the patient would not be able to cough the thing out, and we have to help the patient by giving back blows and abdominal thrust in that patient. Now, how to give back blows? What you do is that you lean the patient over on your one hand and you slap the patient's back by the heel of your other hand. You slap the patient's back by the other hand. That is how you give the back blows. You give 5 back blows to the patient who is choking. And the position should be that the position of your heel touching the back should be between the scapulae of the patient. So lean the patient over your one hand and then slap the patient's back with the heel of your hand to help the patient remove the foreign body from their airway. Now, how to give abdominal thrusts? What you do is that you stand behind the patient and you make fist of your one hand and you cover the fist with your other hand, and you place your hands between the belly button of the patient and the end of sternum and the belly button. Midway in the epigastrium, you place your hand and then you apply the force toward yourself upward. You apply the force toward yourself upward 5 times. That is how you perform the Heimlich maneuver. This is where you place your hands between the belly button and the end of sternum. You can even palpate the end of sternum on your own body to memorize it. So this is where the bone ends and the stomach starts. You place your hands between the sternum and the belly button. You make a fist of your one hand and you cover the fist with your other hand, and then you push it toward yourself in the upward direction so that there is a pressure buildup from the abdomen towards the lung, and that pressure would push out the thing from the airway. That is how you perform the Heimlich maneuver. You perform it 5 times. So we were at a point that patient has severe choking and patient is conscious. You give 5 back blows and you give 5 abdominal thrusts, and you call emergency. You keep repeating the 5 back blows and 5 abdominal thrusts until the choking is relieved or the help arrives. So that is how you deal a patient with choking. So you can simply remember it as cough it out, slap it out by slapping the back, squeeze it out by Heimlich maneuver, call for help, keep repeating 5 times, back blows 5 times, Heimlich maneuver till the time the patient's obstruction is relieved or the help arrives, and give CPR if the patient is unconscious or not breathing. In summary, we talked about what is choking, the causes. We talked about the presentation, sudden airway obstruction with clutching their neck. You assess the severity, ask a question, and observe the coughing pattern. If patient can speak, effective cough, encourage cough. If the patient has severe obstruction, unconscious patient, start CPR. If conscious, back blows and abdominal thrusts. How to give back blows, how to perform Heimlich maneuver, and call emergency. So this was all about choking. If you liked my video, please click on the subscribe button and check out my other videos on emergency medicine. The link of those videos is given in the description below. Thank you very much.